Hello, everyone. Thank you all for joining part 2 of the Healthcare-Associated Infection module for urinary tract infections. My name is Ty McCrae, and I am an infection preventionist contractor with the CDC. As your presenter, I will focus on how to submit UTI events along with recording the monthly summary data into NHSN. During the presentation today, we will discuss the UTI event criteria defined by NHSN. We will walk through how the monthly reporting plans, UTI events, and monthly summary data is entered into the system. And we will then go through knowledge checks to review UTI event definitions and protocols. We will now walk through the steps to submitting a UTI event into NHSN. To enter a UTI event from the home screen, users must click Event and then Add. As you see, users also have the option to find events that have previously been entered into the NHSN application. One may elect this option to review a particular event or perhaps edit or make changes to an event that has been entered. Users can also review incomplete events, which will need to be addressed before data are considered complete. For the purpose of this exercise, we will click Add to add a new event. Next, we will enter the resident information, being sure to complete every field with a red asterisk. The required fields will also include resident ID, gender, date of birth, resident type, first admission, and date of current admission. Next, the Add Event page will pre-populate with the facility ID. The user will need to enter the required resident information identified by the red asterisk. In this case, a resident type must be selected as either a short stay or a long stay. And to define those terms, a short stay resident is defined as being in the facility for 100 or less calendar days from the date of first admission into the facility, or a long stay resident is defined as being in the facility for more than 100 calendar days from the date of first admission. Date of first admission to facility. If the resident leaves the facility and is away for 30 or more consecutive days, the date of first admission should be updated to the date of return to the facility. You will select the date of first admission using the drop-down calendar. Date of current admission to the facility. Again, as a note, date of current admission must occur before the date of event. So, for example, a resident is transferred from your facility to an acute care facility on June 2nd and returns on June 5th. The current admission date would be June 5th. 1 week later, the same resident goes to the emergency department for evaluation on June 12th and returns on June 13th. The date of current admission stays at June 5th. Next, we will review the event information section. For the event type, you will need to select UTI, which is urinary tract infection. The date of event will be the date the specimen was collected. I want to point out here that the event date and date specimen collected cannot occur before the current admission date. The next box, which is a resident care location, requires the user to enter the location of the resident at the time of specimen collection. The populated resident care locations are the locations the facility added during their NHSN enrollment setup and should reflect all of the resident care locations within that facility. By entering the resident care location, the facility is able to monitor UTI trends, in particular, locations within the LTC facility if they choose to do so. If the resident had a specimen collected in an outpatient setting and meets the previously discussed setting requirements, the selected resident care location should reflect the location of the resident immediately prior to leaving the long-term care facility to visit that outpatient setting. Next, the user is required to select from a drop-down menu the single primary service that best represents the type of care the resident is receiving on the date the specimen was collected. The available service types are also auto-populated within NHSN service types, which means they are not pre-set up by the facility. The drop-down options for resident care locations and primary service type options will be the same regardless of the event being entered into NHSN. For the next question, you will enter yes if the resident has been an inpatient of an acute care facility, and that includes hospital or long-term care acute care hospital or an acute inpatient rehabilitation facility, and was directly admitted to your long-term care facility in the past 4 weeks. If not, you will need to select no. If yes is selected, there will be 2 additional required questions which will populate for you to answer. And that includes the date of last transfer from acute care to your facility, and also was the resident on antibiotic therapy for this specific organism type at the time of transfer to your facility. Please keep in mind that a resident visit to an ED or an outpatient visit, such as a physician office, is excluded since these outpatient visits do not represent an actual inpatient admission into an acute care facility. For the next question, you will need to select the indwelling urinary catheter status at the time of the event. That can either be considered in place or removed. If so, 2 additional required questions will populate for you to answer. Those questions include the site where indwelling urinary catheter was inserted, and also the date of the indwelling urinary catheter insertion. If neither is selected, an additional required question will populate for you to answer. That includes, if indwelling urinary catheter was not in place, was there another urinary device type present at the time of the event onset? If yes is selected, an additional required question will populate for you to answer which other type of device was considered. For the next question, the user must specify the UTI criteria that the resident meets. After the criteria is selected, the specific event section will auto-populate to let you know which type of UTI criteria it met. Once the specific event field auto-populates, the secondary bloodstream infection will also appear for you to answer yes or no. For the next question, the user must identify if the resident was transferred to an acute care facility within 7 days. This is important to note that you should select yes if the user was transferred for any reason. The next question is optional. You can answer yes or no if the resident has passed away. If a pathogen was identified, the user should specify the number and type of pathogens that will appear from the drop-down boxes. After selecting the identified pathogen, a drop-down box screen will appear to display all the possible pathogens. Each and those fields with a red asterisk must be completed, which is identified on the screen. The box on the left displays the possible selections for each field. The user may enter up to 2 pathogens for UTI without a secondary BSI. The user may enter up to 3 pathogens for a UTI with a secondary BSI. The last 2 fields that are identified on the screen are optional and may be used for local or group to customize or expand data collected by their facility. In those custom fields, up to 50 fields may be customized with date, numeric, or alphanumeric information. The comment sections is a place for the user to add any additional information about a particular event. Unlike the custom fields, which must be set up prior to use, comments can be added at the time the event data is being entered, and it is free text. Keep in mind that NHSN does not use the data that is entered in custom fields or comments for any analysis functions. Now we will review how the monthly summary data is submitted into the NHSN application. As you will see, this is an example of the monthly summary reporting form. This form is optional, but is available for users to document daily counts during the calendar month. At the end of the month, the daily counts are added. Only the total aggregate counts are entered into the NHSN application. Keep in mind, the required columns on this form will vary depending on which modules and events a facility is participating in. For example, the first column represents the number of residents, which is required for all modules and events. For each day of the month, the number of residents in the facility should be recorded. Do not include residents from whom a bed is being held, but are not actually present in the facility. Also, the number of residents with a urinary catheter complete only in the facility is performing urinary tract UTI surveillance for the month. Next, you will have the number of antibiotic starts for a UTI indication, and you will complete those only if you're performing UTI infection surveillance for the month. Next, you will include the number of residents admitted to the facility for each day of the month. You will include both new admissions and readmissions. In the last column, if the facility is performing lab ID event for a C. difficile surveillance for the month, each day of the month count and record of the number of residents who are receiving any type of antibiotic therapy for C. diff at the time of admission. You will include those both for new admissions and readmissions. It is very important that I point out that only the monthly total will be entered into the NHSN application, which is a total of each column. You're only calculating those columns by summing the numbers recorded for each individual day of the month. The monthly summary data can be submitted by selecting the summary data category on the NHSN dashboard. You will select Add and then complete the required fields, which are the facility ID, and the month and year must be submitted first. And there are 4 denominators which must be submitted each month. Remember, you can always refer to the table of instructions for help when filling out any of these variables. So as I mentioned, for each day of the month, you will record the total number of residents in the facility, and at the end of the month, you will add the daily counts and enter this as the total of residence days. Data may come from any electronic medical record, if you have that available, or if you have some type of recording system that is already in place. And you may also calculate based on facility occupancy. And as an example, you will see if there's 100% occupancy, you will calculate that by 30 days. That will give you 3,000 total residence days. Just as well as if there is only a 90% occupancy, you will calculate that by 30 days, which will give you 2,700 total residence days. Those are just 2 examples to give you an idea of how to calculate facility occupancy. For each day of the month, you will need to count and record the number of residents in the facility who have an indwelling urinary catheter. The aggregate count for the calendar month should be entered as the total urinary catheter days. Please do not include straight in and out catheters, suprapubic catheters, external catheters, or nephrostomy tubes in your count. If the UTI surveillance was included on your NHSN monthly reporting plan, which is known as MRP, but the facility did not identify and report at least one UTI event during the month, as identified by a red asterisk, a check mark must be placed in the box that shows report no UTI. The box will be grayed out and without a red asterisk if at least one UTI event was submitted for that organism during the calendar month. If a UTI event is entered after summary data was submitted, the application will auto-populate. The monthly sum of all new prescriptions, orders for antibiotics given to residents suspected or diagnosed with having a UTI, it will include both catheter associated and non-catheter associated. You will need to count antibiotic starts even if the infection being treated did not meet NHSN criteria for a symptomatic UTI event. You will capture all new antibiotic orders, regardless of number of doses or days of therapy. Do not include antibiotic courses started by another healthcare facility prior to the resident's admission or readmission to your facility, even if the resident continues to take antibiotics while in the facility. New urine cultures ordered for a resident, regardless of whether the resident has a UTI meeting the NHSN event criteria, do not include urine cultures ordered by another healthcare facility prior to the resident's admission or readmission back to your facility. Data may be collected daily or summarized at the end of each month. The final part of the NHSN module UTI submission process, we will discuss resolving alerts to improve data quality. Please note, the NHSN system will automatically check the system to ensure all data is completed properly. The application will send an alert to the user notifying there is missing event info, an incomplete event, missing summary data, or incomplete summary data. These alerts should be resolved prior to using the analysis functions that is available in the NHSN application. The analysis function is how a facility can generate line lists to view data that has been submitted. Alerts can be located on the home page under the Alerts tab, which is identified in the screenshot. One example of a data quality issue would be an incomplete event which has been submitted and saved. To resolve the issue, you will begin by selecting the hyperlinked event number, or you can select the icon that shows incomplete events. Once you have selected the hyperlink or the icon and access the event, it is helpful to review the categories with a red asterisk indicating a required field. Common issues could be missing criteria, specifically a positive urine culture. After reviewing all categories and making edits, ensure the information is saved for the alert mark to be resolved. A second common alert would be a missing event. If there's a monthly report submitted, but no UTI reporting, you must select the Report No Events checkbox. If the checkbox is not selected, the system will alert to a missing event. Again, these two solutions are either checking the box or submitting any necessary UTI events for the month. A third common alert could be generated due to missing summary data. The alert occurs when the summary data has not been entered for a month, and it can easily be resolved by following the Add Summary hyperlink, entering the data under denominators for long-term care locations, and then click Saved at the end. And a final common alert is incomplete summary data. This issue will occur if the data entered has fields with missing or invalid data numbers. The issue can be resolved in a similar manner as the missing summary data alert was fixed. So just please ensure that you have entered all required fields with valid information. Now that we have discussed the NHSN definitions, the module submissions, and how to resolve alerts, let's review some important considerations. As a reminder, it is required for a monthly reporting plan to be submitted into the HAI module prior to reporting a UTI event. Depending on the submitted plan, the facility may choose to report only catheter-associated UTIs. And also, please note that your monthly reporting plan includes facility-wide inpatient, and that must be selected on your NHSN monthly reporting plan. Some important elements to remember when submitting a UTI event. When inputting a UTI event into the NHSN module, the date of event which should be used is when the first clinical evidence appears or when a positive specimen is collected. Please note that infection should be attributed as an HAI if there is no evidence of an incubating infection at the time of admission to the facility, or the onset of clinical manifestation occurs greater than 2 calendar days after admission. Also, there's some additional terms you should remember. The resident type. A resident type must be selected as either short stay or long stay from the date of first admission. Your resident care locations must be added during the NHSN enrollment. The date of first admission is the date of initial admission, and it remains the same even if the resident leaves the facility for short periods of time. And also the date of the current admission, which is your most recent date the resident entered the facility or the date the resident is readmitted. Also, it is important to note that the UTI denominator data should be entered into the NHSN application each month. There are 4 denominators which may be submitted. your total resident days, your urinary catheter days, new antibiotic starts for UTI indication, and the number of urine cultures ordered. Also, there should be a total of each column, which is calculated by summing the numbers recorded for each individual day of the month. And lastly, the NHSN system will send an alert to the user notifying if there's any missing event info, if there's an incomplete event, or if there's missing summary data within the system. It is important to clear those alerts to ensure the most accurate facility data is being captured to run your analysis. And again, these alerts can be found on the home page under the Alerts tab. This concludes part 2 of the UTI submission. So thank you all for your time today. And again, if you have any questions, please send your email to nhsn@cdc.gov and make sure that you add UTI reporting in the subject line so that your question can be routed to the appropriate subject matter expert.